Hello, I'm Chris Bourne. I've been working as Chief Executive in NHS North Somerset for the last 4.5 years. This is my last podcast, in fact my first video cast, but the last podcast in the role, because I've now handed over NHS North Somerset to Deborah Evans, who's going to be leading all three primary care trusts, Bristol, North Somerset and South Gloucestershire, in the new primary care trust cluster. I just wanted to say thank you really to everyone who's worked with me in North Somerset over the last 4.5 years to see such and make such improvements to patient care and to see an improvement in the health of local communities, particularly our more deprived communities, and who've worked so hard to work strongly together in partnership to make North Somerset a better place to live in for everyone, all our 210,000 people. So it's a big thank you to people for what we have achieved. Sometimes you ask yourself why we do these jobs. They're very demanding, there's a lot of ambiguity, and people do feel quite stressed to achieve everything they want to achieve for patients and local people. And I suppose it is because of the people that we do it. It is the thought of those people who have got health problems, long-term health problems, people with acute problems, people whose health could be better if only we could help them live healthier lifestyles. And it is the people we work with, our immediate colleagues, but also all our partners for us in the health service, partners in the local authority, in the voluntary sector, in the private sector, and across all the lay people who help us do our work and advise us on what to do. So we have a lot to be thankful for, and that's why I think why we're driven to do the job, to make things better for people and to enjoy the relationship. It was a very interesting and hard-working 4.5 years in North Somerset. It was quite tough at first. We had a lot to do to improve things for patients, improve things for organisations, and including especially the primary care trusts that I was heading up. And I really would like to thank all the people who were with me in those early days, through quite a difficult time when we had big financial problems and we weren't achieving as much as we wanted. But there were some really good people who I joined in North Somerset, and I'd like to thank all those people that worked with me in those early years to help us solve a lot of the problems and start to get much better performance for us in the health service and in health across North Somerset. I think we've achieved a lot, and it's worth just perhaps reflecting on that as we come to this change to the new primary care trust cluster. We've done it obviously not on our own, we've done it with the help of partners, and the partnerships we've had have been incredibly important for that. But I've got a little list here of things we've done. I think we've attracted some excellent people to join us in our work here and developed a community service of district nurses, health visitors, therapists who've done a fantastic job to improve services, to build up services in the community for our patients and for their carers and families. And we've also achieved what we set out to do, which was a commissioning organisation that could truly be called world class, because I think we have got fantastic results for people in North Somerset. Still more to do, and certainly we're not complacent, but we attracted people who wanted to do a really good job for local people. I think we have transformed our relationships, particularly with our partners. I've talked about the local authority, but also with GPs, who I think when I first arrived didn't think the primary care trust was giving them enough support. With patients, with the public, and with the voluntary sector, with the representatives of patients, such as the local involvement network and the health overview and scrutiny panel, and indeed with the rest of the NHS and all our colleagues in the hospital organisations, mental health, ambulance trust, and so on. I think we can say now we're one of the top performing primary care trusts in the Southwest. We've got improved quality, and we can see that in lots of measures, for example around waiting times and so on, and around the quality of patient care through the improvements in patient safety and infection control, things like that. We have improved access to a whole range of services. I think everywhere you look you can see an improvement in every single service, whether that's talking about early years and maternity services, or whether it's all the way through to the end of life. And I think we've also seen a real improvement in health through the work we've done on things like smoking and teenage pregnancy, and also improved the satisfaction that patients have with their services and their carers have with their services. And we've also improved staff satisfaction working for the primary care trust. And alongside all that, we've achieved the financial stability that we were so lacking 4.5 years ago, so that we are able, despite having a comparatively low allocation level, to make ends meet within the Primary Care Trust budget. I think there's been recognition of our work to tackle health inequalities, and we've had a national team visit us and say what we've done well to try and prevent ill health, and also particularly tackle those inequalities in the most deprived areas and in the most deprived communities. So that's good to recognise that work. More to do, of course, still there. And as I say, if you look at nearly every single service, whether it be mental health or learning disability, if you look at stroke or cancer, if you look at heart disease, primary care, I've mentioned end of life, urgent care, you can see improvements. For example, the joint work we've done with Western Hospital to open a new urgent care centre at the hospital jointly with primary care. As I said, we kept a focus on quality. Things like infection control, dealing with pressure sores in hospital and indeed in nursing homes. And the work we've done with nursing homes has been very important to try and improve quality for people who are cared for there. Seen some symbols, if you like, of this improvement through new buildings, like the Marina Healthcare Centre. We've invested well over £1 million in the redevelopment of many of our primary care premises, GP surgeries, and that's enabled them not only to provide more service but also more training for staff and for people coming into the professions. And we've also obviously supported a lot of the key developments in Bristol, which our patients use, such as the new Heart Institute at the BRI, and obviously the building of the brand new hospital at Southmead Hospital that's due to open in the next couple of years. So we have much to be proud of. And I think what this means is that the Primary Care Trust, the GP commissioners, as they're coming into their own now to commission services, have a very strong platform to build on. We have a great leadership group of GPs, some of whom have only come into this role quite recently, who want to take on the responsibility for commissioning services for their patients and for their families. And I think that'll hold us in very good stead, that we've got people who want to make things better for patients and know what to do, and will be well supported by the managers who've been doing the job in the Primary Care Trust. We have a much strengthened public health department. It was quite small, it's still not huge, but we've brought in more staff, and the people who've worked there have done a fantastic job, but have been helped by the new people coming in. And I think we'll be in a very strong position to move into the local authority and to be leading with all the local authority departments the improvement to health we need in North Somerset, and particularly, as I say, in the more deprived communities. I think we have established a community service that is strong. Still obviously work to do, still under huge pressure from the demands that we place on them to see a lot of patients and their families, but they will be ready to set up and run themselves as a staff-led social enterprise. And that starts in October, fully fledged in October this year, and I think we'll see a very successful organisation working with our partners again in North Somerset. And of course our commissioners who now join the PCT cluster across Bristol, North Somerset and South Gloucestershire, and they've got a strong commitment to North Somerset and will bring a local flavour to the commissioning that needs to be done, and the development and the performance management of services to make sure they're providing the right service for patients. And I think we'll have led by a very capable locality director in Jeanette George, as well as working across the whole of the new cluster team to make sure North Somerset services remain good and improve. So highlights for me, well, I leave North Somerset very sad, because we've had a very good team that's built up around the work we've done. It's difficult to pick out any particular ones. I guess facing the music sometimes are things that stick in your mind, and facing the music in Rington seemed to happen quite often, being out in the rural area and first of all dealing with concerns that district nurses were going to be less available if they were going to move out of GP premises, which we stopped, and also that people had these worries about the big polyclinics taking over from GP practices, which of course was never going to be the case in North Somerset. So engaging with our local people has been certainly one of my highlights, even if it's quite tough sometimes. And I remember too working with the carers and service users from Orchard View, our unit for people with physical disability, which provided respite care, and people really didn't want the change there, a lot of people, but actually now we've set up individual packages of care for people. They've got a service they're very, very happy with, so in just about every single case. So you deal with concerns and you listen strongly to people, but you also take things through that you think are going to be much better for patients. Going out and meeting with practitioners. I mean, I'm a social worker by background, and I love going out and meeting the people doing the job directly with patients. So practitioners, going out and visiting them regularly, some often with the chairman, has been a great privilege, really, and also really helped me understand the issues that are being faced day to day with patients, and so helping us make our strategic decisions. I think some of our set-piece events have been fantastic in the Winter Gardens, often in partnership with the local authority and a whole host of other stakeholders. We've created days when people can really make a big contribution to the thinking and to the development of services and health programmes. And that's been, I think, very important to both recognise what's been achieved and also get ideas for the future. I've enjoyed our annual meetings where we've had celebrities giving out staff awards, and they've been very special events remembering people's excellent work, and together with things like the grand opening of the Marina Healthcare Centre. That was a very good day, and I think those events are important, not most of all because it's an opportunity to say thank you to people for all the work they've done, and to all our partners who've worked closely with us. I do think we've created a very strong commissioning organisation, and the work we did on world-class commissioning really did help us develop into a much more effective organisation. And for me, going and visiting other primary care trusts on a world-class commissioning panel was a great privilege too, to see how other people do it and to learn that and bring that learning back to North Somerset. I think we've had a fantastic professional committee and commissioning group that's worked with GPs. So the leadership of GPs is not new in North Somerset. It's been a very strong partnership between the PCT managers and GPs to make sure we get the right developments agreed for North Somerset, which is what makes me hopeful for the future. I think I've very much enjoyed doing work across the wider area, developing the Bristol Health Services Plan and what's now Healthy Futures, and also leading programmes around urgent care, pathology, and also with the information management and technology across the area, and making sure we've all got proper systems and developing systems that can actually start to talk to each other. There have been particular things I've enjoyed working with commissioners on, developing, for example, the primary care mental health service, which was a big lack in North Somerset, and everyone said it was when we first arrived. We managed to bring in a new partnership to provide that service. And, for example, looking at how we could integrate children's services with the local authority, I was very directly involved with that, and that was really interesting and fascinating work to develop. What we've done on stroke care, for example. And then taking a wider view of North Somerset with the North Somerset Partnership, looking at the nighttime economy in Weston, for example, or dealing with issues about how do we help small organisations through the recession, how can we use sustainability and green economic development to be a way of recovering from recession, as well as tackling some of the issues of climate change. I think celebrations have been important. I think we've celebrated often when we've got good results, and that's been important to recognise what people have done. I think we've had a lot of laughter, as well as a lot of very serious discussion, and sometimes, challenging discussions, both internally and with our colleagues. For example, the work we do with Western Hospital, very, very strong relationship there, sometimes a challenging relationship, but that's, I think, produced really good results for our patients. And I suppose on a very personal note, there was one I was asked to compare a not quite strictly com dancing competition for a local charity, and playing the Bruce Forsyth character I loved. The next year, though, I decided I wanted to dance. That was probably the wrong decision. Being a leader is always challenging. I think it needs a combination of guts, brains, love and strength, and I hope everyone will be in a position to take things forward as a leader, whoever you are in whatever position, to improve things for patients and to improve things for local communities, because that's what I think we all most care about in future. But for the moment, thank you very much, and I wish you all the very best. Goodbye.